We are in the October Nutrition Coordinators meeting, and we'll go ahead and start by going around just seeing what people are up to. If there's anything new in your area, any challenges that you're facing, this is a good time to just kind of play off each other and see what's out there, what successes you're finding with nutrition programming, what challenges you're finding. So we'll go ahead and start. And I think Kayla, you guys are on at Northeast. So if you want to start.
Good afternoon. Yeah, not much to report here. Our senior centers, there's been no changes with meals or anything, any services like that. But our 3D program, our local health department is starting a bingo size at both the Norfolk Senior Center and I think at the Pilger Senior Center. So that's exciting. They're having class signups at the moment. I don't think they're starting till mid-November or into December, but that's what is going on new here.
Excellent. That sounds great. And yes, you're starting bingo size, so that's really neat. I know that other areas are kind of starting that too, and I think that they're having success with that. So that's really good to hear. Awesome. Any questions for Kayla at Northeast? If not, let's move on then to Devin. Devin's filling in for Jill. Do you want to go ahead and give us kind of update, Devin, on what's going on at AP?
Yeah, so I will say that our smaller areas are tougher. In our rural locations, it's tough. Because the population is so old. So there's kind of a intergenerational change there to get younger people into that program. We do bingo twice a year, once in the spring and once in the fall, which we've done that the past couple of years, and that's a huge hit. In September, I did about 33 games of bingo at our senior centers, and we're serving about 170 meals a day to 7 centers.
That's awesome. Yeah, you guys have done a really good job, and I know that with Victory Park and everything, your services have increased quite a bit.
Yes.
And we also have Karen O'Hara on here too on this call, and I just met with her during monitoring. So thanks for joining us. Do you want to chime in anything with Aging Partners Health Promotion, Disease Prevention?
Sure. Yeah, I'm not involved with the nutrition programs, but we are doing have a couple new 3D programs starting. We have one called Strong Bodies, which is a evidence-based strength training program, which we're starting in November, and also in November we're starting Bingo Size. So we're excited to add those two onto our schedules.
Well, that's awesome because as Kayla had mentioned at Northeast, they're adding and expanding on doing bingo size, and so it's really neat to see that.
Yeah, we're excited about it.
That's great. All right. Well, thank you both so much. Any questions for Devin or Karen? Thank you so much for joining us. All right. If not, then let's move on down to, let's see here. Carmen, I see you're on for Blue Rivers.
There we go. Well, what we're doing right now is I am just getting ready to go out and do programs at all 14 senior centers on hidden sugars. And first one starts the 1st of November, and I'll do them all in the month of November, the 1st of November, and I will do them all in the month of November. Go to all different 14 sites and do that. I think it'll be a real interesting program. I'm learning a lot as I go through and find all the hidden sugars and in different things, and what's out there, and what's the best fruit to eat, what's the best bread to eat, there's all hidden sugars everywhere. So that's kind of the exciting part for us right now. We are going to be also looking at bingo size. And our numbers really have not fallen off for our area. Currently, off of September numbers, we were feeding probably close to, that's the wrong one. probably close to almost 800 to 850 a day through all 14 counties, or 18 counties, 14 sites. Lord, I don't need 14 counties. Anyway, like I said, bingo size, we got new trail sealers in. Those have gone out to 2 sites. Those are currently in Beatrice and Fairbury. They will be using those for some of our weekend meals that we have for our Title 20s. And they're pretty excited. Beatrice was thrilled to get theirs and get it started after we had so many issues with getting them up and running. I seem to be an expert on it now. So if anybody gets any tray sealers, let me know. I think I can walk you through about every step. But anyway, we're going to start that. Beatrice has already started. Fairbury just got theirs yesterday, and they're getting ready to start so they can freeze those meals, take those out for weekend meals, and then we can have those on hand in case we would have an emergency, possibly, to be able to help the people that we really need to help in case that would happen. So that's probably the most exciting part, is that, and getting out and doing the presentations on the hidden sugars.
Hey, that's great, Carmen. That's really good to hear. That is really neat. And look at that bingo size spreading like wildfire. That's awesome. And also,
I think we can give that to Rachel, because she was the one seller of that.
yeah, she definitely
When
was.
we were in Omaha. So
Yep. Thank you, Rachel. No, for sure. I think that's awesome. Well, and that's really cool. Great presentation, education presentation on that. Well, yeah, with hidden sugars and things like that. That's really cool. So, well, good for you. That's really neat. Getting out there and doing some programming. Luckily, the weather's been really, really nice here to be able to travel right now. We've been really lucky with that. So, that's really good to hear. Any questions for Carmen at Blue Rivers? Thank you so much. Let's move down then to Rachel at Midland.
I don't know where the time has gone since we all met in Omaha. I feel like it was just last weekend. I've just been doing a lot of monitoring, just going and checking on places, making sure signs are right and temps are, just going through the masses of all of them. I've been working really hard with our kitchens and the menu planning and trying to get everybody just ordering the same product. Everybody kind of has their own way that they like to do things, and it's trying to find a positive way to get them to understand why, why if you have a meat slicer, you don't need to buy sliced meat type of deal. And so I'm really just trying to work on getting everybody on the same page. I kind of used a buy-in of, I can't say that it's right or wrong if we're not all doing it. So if you guys could all just do it for me for the next 3 months, the way I'm saying to do it. And if it's wrong, I will be the first to admit that, it made no difference, or it was worse, or it was better, but give me 3 months of perfection. Just because I'm really trying hard to get that meal cost down, while we're still okay funding wise, so that when the time does come that we have to, really make sure we're keeping the corners crunched, that it's not as traumatic, I guess. I kind of have some worries of when that time does happen, of a lot of these people were hired during COVID. And so they don't really know what the funding was like or the structure was like pre-COVID. There was just so much flexibility and not as many worries. And I just making sure that they're logging things the way they're supposed to be logged, and that there's no, gray areas. Let's just black and white it. And I don't know, we'll see. I've just been doing a lot of talking, I feel like.
That's all
And
right.
it's also like health fair season and
Mhm.
info fair season. And so we've just been out there trying to get our information out more.
Well, that's great. And yeah, I like your example of, yeah, if you have a meat slicer, don't buy the overly expensive pre-sliced meat. Yeah,
And I
just a little
get it.
common
Everybody
sense.
wants easy. I mean, it's not,
Right,
I
right.
like buying sliced pork myself, but if I'm on a budget, I buy a pork loin and I slice it myself.
Yep,
I
yep.
just,
What's the price difference? You just have to factor that in. That's fine. But those are good, good examples of those little things that can add up to be big over time. And that's
yes.
very true. So, and being consistent is really good. So watching those margins is really smart. So that's awesome. Well, good work. I think that's good. And yeah, I mean, getting everybody on the same page is really important. And yeah, that's really good. So, well, very good. Any questions for Rachel at Midland? Thank you so much. If not, we'll move on to Samantha. I see you at AON. We can.
Um, Not too much has changed since we met. Our home delivered and gearing is growing like crazy, so that's kind of exciting, but also stressful because then we need to obtain more volunteers. Um, we have vaccine clinics going on at various sites right now. And I'm honestly just wrapping up farmers market paperwork and doing a lot of site monitoring myself. So trying to get those in before we get terrible weather. And the same as Rachel, checking the signs, making sure the temps are good and just yeah, making sure everybody is where they should be. But aside from that, I don't think I don't think anything is new, really. It's been kind of quiet.
That's good. Well, we'll knock on wood for that. Being quiet. Well, that's good. Yeah, and the weather has been nice too. I know your side of the state will probably it's going to get chilly here coming up. There's definitely some changes this weekend and stuff, and that does affect our service and stuff in a lot of ways. So we've been really lucky across the state to have a good fall so far. So yeah, that's been awesome. Taking care of business before changing weather. So very good. Any questions for Samantha at AON? All right. We have Caitlin on from NOAA. Do you want to give us an update? Oh, there she is.
Nothing major has changed or anything new. We're just gearing up for that we have. So get some flyers out for Thanksgiving, Veterans Day, Christmas, all of. So that's pretty much.
Caitlin, your mic was a little quiet there for a second. I think we missed the last part of what you said.
Oh, I said that we're just gearing up for all of the holidays. So we're sending
Okay.
out frozen meal flyers.
Oh, very good. Okay,
That's what we've been working on.
cool. Very good. Awesome. Well, very good. Any questions for Enema or Caitlin? All right, perfect. I don't know if we have Sue Hutzel on from South Central or anybody from South Central. They may be out of office today. So I think that pretty much completes kind of our updates. We have anybody from West Central? Have anybody from West Central on? They may not have been able to make it either. So I think we're missing South Central and West Central. But that's okay. Anybody have any other questions for anybody else at this time? Any continued challenges at centers or other than the usual?
Other than the usual, this is
Right.
Carmen again.
Yeah.
Keeping costs down. Rachel and I kind of brainstormed a little bit to try and figure out what we can't do to keep those costs where they need to be. I got on and kind of wrote a fiery email to all my site managers, but like I said, we're a little bit different because we have all of ours are run by us. And I said, you know, we're looking at every option out there, but you've got to be I have stressed they have to be just not ordering the easiest thing out there. Rachel, if you have a meat slicer for sale, I'll buy it. Because I got one that's just dying for a meat slicer. Anyway, but it's amazing how after that email, my numbers went down on the cost of our raw food costs. It's like you just got a bargain shop as if you were doing it for yourself. And that was kind of one of the ways I got through to them is you've got to do it. If you were out there buying for yourself, would you buy this product? And then sometimes we find that the distributors are nice enough to substitute something that's a much higher amount. And that doesn't fly real well with me. So anyway, that's kind of what we're doing. Raw food costs are still our biggest issue right now.
Carmen, thank you so much. That's a great point. And yeah, just like you're shopping at the grocery store, you know, and you're going, take a list and write down everything and try to add it up and say, this is in my budget. And look at this. This is a lot cheaper than this brand. It's just the same. And so, yeah, for sure. And I almost think with some of the, you know, distributors and things like that, it's, you know, they put those prices out there, but they don't have a red arrow that's pointing to it that says, pick me, buy me. You know, it's just that choice is there for you to pick, and you have to just be conscious to pick the right one. So,
Well, and even Carmen and I were talking, and I've kind of been doing some price comparison of the individual fruits. And so we go through Cashway and they build our menus and they tell us it's supposed to be about this much per serving is the cost. And so there was applesauce being served, I don't know, one day or another, and it was 53 cents a piece. And so then I went through, and if any of you have ever utilized the Cashway website, it's atrocious and terrible. So after yelling at it for quite some time, I finally found individually packaged applesauce, and it was, the unit cost was like 42 cents. And so even their listings that they say are going to be your most effective cost, well, now you're buying a container to put the applesauce in and you're paying the staff to fill the applesauce, when if you bought these darn little Mott's applesauces that are already packaged and ready to go, with a shelf life of like 50 years, but I don't have the time to go through and find, is it going to be cheaper for me to buy this already cut or packaged versus is it cheaper to prepare it ourselves? I think that's one of my biggest frustrations right now is,
yeah.
I mean, there's just not, that's a big menu to go through weekly and price compare. It's not like just your little shopping list for your house.
I also found the same thing, that it's cheaper to buy sometimes pre-made than it is to buy it, to put it in. One of the biggest complaints my team has is they'll go to dish up. You're supposed to get so many servings out of a number 10 can, and you base everything off of that, but there is no way you're going to get that amount of servings out of that number 10 can. The numbers work, but the spoodles don't work. I mean, it just, if you may be 2 or 3 short, and that's frustrating because they're figuring just, you know, they're working on their budgets too. So anyway, just little things like that. But yes, I don't want to micromanage, but man, we're having to really micromanage on these food costs.
Yeah, exactly. And that is just one of the challenges today. And that's, yeah, that's definitely across the board. And that is a national thing as well. I mean, it's just kind of one of the things that we're looking at, and kind of the sign of the times right now. You know, things come up, things go down. But yeah, right now, I think overall it's just trying to practice that thrift sort of. And yeah, that's kind of what we're looking at. But you guys are doing a really good job of that, and that's the challenge. You're becoming experts, really. So, well, very good. Any other questions? Really appreciate the insight on that, Carmen and Rachel. I think that really does help. Just kind of also lets people know that, yeah, there's a lot of challenges out there. Well, with that, let's move on. We can probably wrap up our meeting here in the next few minutes, honestly. We don't have that big of a group today, but I do want to go through the example spreadsheet I have that I had sent out. So I will go ahead and share my screen. Okay. Can everybody see this okay? All right.
It's extremely small.
Okay. What about now?
Well, just a little better.
Okay.
Let me see if I can
So-
make mine. Let me see if I can make mine bigger. Oh, there we
Okay.
go. That helps. Okay.
I was gonna say you if you have the window small, it may be
Yep, I got it. I'm good.
So here is, let me just kind of show you real quick what our thought is behind this. Now, the neat thing about our SharePoint site, and what we can do is we can keep a tally of senior centers, and we can also revise this list over here. Like, this is from the 10th, and we can go through and divvy up, hours of operation and what is served and other services provided, location, and then also assign it to an agency here. So we've done a really good job of putting this list together, and this list has evolved over time. And you all have done a really good job of sending up updates to it as well, because I think that it's not easy, but we are able to publish this so that we have a grasp on what we serve and what you guys serve ultimately, as a part of your agency. And that's really important, I think, is just part of state and local government, to be able to show what is served and where it is served. That's just part of being transparent, and that's part of being responsible for your locations. And so I think that this list overall has done a good job of that, and we'll continue to maintain this list of senior centers. So I showed you that to show you a potential new list. I don't have to say that. And this is something that we would be kind of developing with the Department of Public Health here at DHHS. And this wouldn't be as comprehensive, but rather it would incorporate more or less 3 things. Now, this is the public health side here, and this tracks what local health departments are providing and where and what programs. Okay, so they've already kind of got this established on what is being offered with chronic disease prevention programs, and as well as falls prevention programs. And so they've literally just come up with a partnership organization column here, and then they've also divided up the different types of programs here, and then just placed an X as to who's doing what. Okay. Now, they also have a tab here on counties and what health departments provide. But the problem is there has always kind of been this overlap that exists between the AAAs and what the public health departments are kind of offering and what public health here offers as well. And so it's kind of like a Venn diagram where it's basically trying to figure out what's common in the middle. And what we want to try to do is collect information from you guys on your specific location, program, and then county. And I think that that's all at this time that we're going to collect. I don't know if we would collect any more from you guys just because it would be too complicated to get like specific details on times and stuff like that. That'd just be way too detailed. Because these programs obviously, you know, they are only offered so, you know, for so long, and they change locations, and they you know, they change times and people who conduct them and all that kind of stuff. So it's not like a senior center. It's vastly different, but it is a program that is being done like here at the Olympia Senior Center. They're offering, this is just an example, bingo size, stepping on Tai Chi strong bodies at the Mount Olympus County. It's a AAA. So it's just, these are just examples. The Vegas Senior Center is offering bingo size and Tai Chi in Roulette County, and that's being put on by the health department. So these are just a couple examples of, like, if your area agency has a location in which they provide these things, and if you have a contract with them, basically this is where you would put that here. And that's just a contract between you and the health department to say what you provide. So what we want to try to do with this information is receive the information from the AAA that would fill out these 4 columns just for what you provide for programming. And then it's going to be between public health and the state unit on aging to come up with a document ultimately that can put this together so that it's a little bit more user-friendly and legible, and just something we can post online so that we know, if anybody in Nebraska knows, if there is some sort of Title 3D programming, which is our health programs, where it's being offered. And it's not necessarily the times or anything like that. That's way too detailed, but rather it's just going to be, where is this being offered and from whom?
And so, just a quick question.
Yeah.
Like our health department, South Heartland Health Department, they provide stepping on classes. Sometimes we provide a space for them to do that and help with setup and things like that, but it's not really a contract. Should I just still list those?
So what you could do, and that's a good question too, Rachel, is that you could, if you wanted to, it's basically who's ever, you know, the 3D funding that's coming
Okay.
from ACL. It's like, if you are utilizing the funding to give to the health department to put it on, that's one thing. Or if you are utilizing the funding yourself and the trainers are coming from Midland, I would classify it more as than Midland
Okay.
or health department, on depending on if you have a contract or not. Now, if you have a contract and they're putting it on and you just literally give them the money
Give
to
them
do
funding.
everything,
Okay.
right? And you just say, hey, but our contract says, and this is just a kind of a double way to check that what they have on their side is matching what you have on your side too. Is just, if
Right.
you have a contract and you say, you know, they're going to provide X, Y, and Z for the month, you know, months of, or this fall. This fall, we have a contract that they're going to offer bingo size and Tai Chi and stepping on at these 6 locations, and they are located in these 6 counties. That's all the information that really we're
And did you send us this
kind of
already?
looking for. No, this is just, I have just presented this today,
Okay.
but I can send it out, and that's why I kind of want to discuss it first, just because I want to make it as easy as possible. I don't want to make this a difficult task, and so I think kind of what we want to do then overall is we want to be able to have a document that is sort of like the senior center document, where we have Title III-C stuff with senior center stuff, and then we have Title III-D stuff with this evidence-based program composite, essentially. And that way it shows that, you know, we are utilizing all of our funding to show what programming we're doing across the board. So if anybody came to us and said, what are you offering? We could say, we're offering nutrition programming in all these senior centers, and we're offering evidence-based programs here, 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 and here. You know, that's I think ultimately, and here, I'll stop sharing my screen here unless anybody else has a question. That's kind of the
I
ultimate.
got one more. I'm sorry.
Oh, no,
You
totally...
don't have to share your screen again though. But so in some of my places, so like in Webster County, it doesn't happen specifically at the senior center. She kind of travels around and does things in community buildings. So can I just put the county and that it's offered in that county?
Yeah, because I think what we're gonna, and what we can do is, if you wanted to, like with location, if they travel around, I mean, if you want to provide us as many details as you want, that's fine. But if it's something like that where they have it kind of like as a pop-up, the county would be fine, just because like it's too detailed to be able to show where they're going to be. Because if let's say they just rent out a space, right? There's just no way to track that, and nor should you, because that's just doesn't make any sense. So if they're just like in Adams County and they are just doing it in several different places, then you could say, well, you know, this is going to be available in Adams County. Call Midland on call Midland for details or whatever. You know what I'm saying? Like that's kind of what we would be looking at. But ultimately, you know, as a state and as area agencies on aging, we'd be able to have all of our ducks in a row and say, this is what we offer. And that's kind of the thinking, I think, behind, well, and it's not only just having our programming listed for the public, but it's also part of like just showing that like our programming is being consistent, and we're showing that we can have an impact on the community, and this is what we're offering. So and I think as far as like these kind of documents go, that's pretty much all that we had ever planned on. But we had to kind of work with public health because they're offering a lot of the same programs, and just having 2 silos, we wanted to more or less combine this together to show what they're offering and what we're offering, so that is a little bit more well known. So what I'm kind of proposing is, with this document, I will send it out, and if you want to, feel free to just fill in what you can and what you want as far as what your programming is currently. You can send it back to me, and then I'm going to work with Lance and also the folks over at Public Health, Lindsay Steele and Jamie Hahn, and put together a list that we could post on our SharePoint, and then you guys can probably use your links if you want to have links to our sites or whatever, however you want to do it. You know, you can have access to obviously the senior center lists, and also the 3D lists, and that's kind of that. So. All right. Well, I will be sending this out. Let me see here. Does anybody else have any questions?
Eric, one question I have is, do you need any unused coupons for farmer's market?
If they're unused, that's a good question. If they're unused, you can just shred them. Yeah, we have about a week left. And I don't know of any farmers markets that are actually even really open around here right now. So, if just shred them, put them in the shredder.
You don't need anything back then?
Just sending back I mean, however you want to do it. If you want to scan, if you want to mail, however it works best for you to send me the information. That's what's going to be sent to storage. So, but if as far as reducing costs, send me what you want. But I do need to have, whether it's electronic or whether it is physical, obviously the applications and the debarment suspension sheets and the lists of people. So those will need to be sent to me. So just depends on when you want to get those over, but if you want to call me later and discuss it, you can do that. So however you want to send them, up to you. But yep, we are vastly approaching the end of the farmers market season. I have sent 2 emails to Department of Ag, trying to set up a SurveyMonkey meeting. And I have not received a confirmed response back yet on their willingness and participation for a January meeting, but I'm going to keep trying because we are going to have a meeting next January with Department of Ag and all of you, so that we can have a better farmers market year coming up. Even if I have to get in my car and drive over there, I will find them and say, we're having a meeting. Okay. We're going to have a WebEx meeting because I would like to have, I would really like to have a meeting with the bank, and with the AAAs, and I'd like to have probably even the directors on there. And I'd like to have obviously Department of Ag, and if they could get the printers on there, that would be nice too. It doesn't necessarily have to be them since they may change. They may go with a different printer. I don't know. I think that one was out of, what was that last printer out of? It was Davenport, Iowa. So they go with different ones every year, but the bank I think is going to remain the same, and obviously Ag and us. So hopefully they respond, and next year we can get a meeting going and talk specifically about times that we need to receive the coupons, because the guesswork and all that stuff, that's really causing a headache for everybody. And I don't think they understand how big of a headache it actually is. So anyways, I will continue to advocate for that. So, all right. Any other questions? You get 20 minutes back on your day. All right. If not, you all have a fantastic rest of your week and October, and we will see you in November.
Thanks, Eric.
Thanks, Eric.
Thank you all.